Why, hello there. Welcome to another episode of That Can't Be Right, a podcast about exploring structural wrongs, cultural oddities, and wild opinions. I'm your host, Ryan Rogan, and Father's Day is coming up, so today we're talking about dads. As always, please subscribe and leave a review so I get the validation I need to keep making new episodes. And I'm stumped about what to get my own father for this made-up holiday, so if you have any ideas about Father's Day gifts, send them to me at TCBRPod on Twitter and Instagram, or thatcan'tberightpodcast@gmail.com. Let's get into it. I cannot stand when men use the phrase daddy daycare to describe taking care of their own kid. If it's your kid, it is childcare. It's not daycare. And if we talked about how much people at your kid's actual daycare made, you would not refer to yourself as a daycare employee. As an aside, if anybody wants to talk about how little we pay caretakers, pediatric, geriatric, slide into my DMs. Would love to do an episode. But I'm willing to leave room for the very small, very tiny possibility that I might be being too judgmental when it comes to talk about dads and raising kids. So how should we talk about paternal involvement? Obviously, I don't know. And as I wrote that, I was like, oh, it sounds like I'm saying I don't know because I don't have a father figure in my life. No, my dad was very active. Big Roy, sorry for the phrasing, but I don't know because I'm a woman and I don't have kids. So I wanted to talk to an expert, talking to Jide Bamishigbin, health psychologist and assistant professor at Cal State Long Beach.
Yes.
His research focuses on the experience of new fathers, particularly those from diverse backgrounds. And he's also a Twitter instigator. That's how I found him. Inconceivable takes on cheesecake. He's okay when it comes to Snickers and pink Starbursts.
I prefer Twitter truth teller.
Truth teller. Your truth.
Truth sayer. Okay.
Because some of cheesecake was like, you had cheesecake last on the list of excellent desserts.
There's nothing worse than cheesecake.
I don't want to get distracted. That could be the next episode.
Sorry. We can do this all day. You're right. Sorry.
Yeah. That could be, if this conversation goes well, we could do a whole episode on how good cheesecake is. I did an episode on whether or not Beyonce has released an R&B album. There's no scope to this podcast. It's whatever we want it to be. But welcome to That Can't Be Right.
Thanks for having me.
Let's jump right into it. What inspired this research? Is this what you went into grad school thinking you were going to be talking about or exploring, or how did you get here?
Yeah, so it's funny, sometimes your job finds you, you know what I'm saying? So this is one of those cases where I was an undergrad. I did research in a lab focused on cancer, actually. So I went to grad school to study cancer and how it affects people who are dealing with cancer and their caregivers, you know what I'm saying? Because it's a debilitating disease. It affects a lot of people, so I really wanted to focus on that. So during my first years of grad school, I was working on my master's thesis to make sure I was able to get this project out focused on cancer survivors and depression in Black, Latino, and white cancer survivors. And I was waiting on this data and it just wasn't coming. Okay. Like it just wasn't coming. All right. I'll let you know. I was expecting that data summer 2013. Right. So I could finish my master's fall 2013. I did not get that data until summer 2015. All right. Ew. Yeah. So in that time, it was like, okay, I still have to do a master's thesis. Like, what am I going to do? Right. So one of the faculty members in the department said, hey, Jide, I have this data on dads. Come on. You're just going to do this project real quick for your master's thesis. You'll go back to the other stuff, and the rest is history, like that was it. Right. I did that project. I got invited to go to a conference on paternal depression through the White House and the National Institute of Health. And then a little while later, I found out that I was having my own baby. Surprise. I found out I was having my own baby with my girlfriend, my now wife. And that's how I got into it. And it's just stuck ever since.
Very cool. Very cool. And it's crazy how things happen, right? Like you might run into a wall but eventually like you go down another path and it's just as good, just as
Right.
interesting, just as important, and just as relevant to you as a father. So part of that can't be right is me reading the things that everybody else kind of skims or just reads like the Twitter headline. What was the scope of this research project specifically?
Right. So this research project, or I guess the one that's gotten the most attention, right? They talked about it on the Today Show and CNN, right? So we did this study called the Community Child Health Network study. All right. And the study's goal was to understand racial, ethnic, and socioeconomic disparities in maternal and child health. Okay, because we know that Black mothers and low-income mothers in the United States suffer the burden, right, of preterm birth, low birth weight, infant mortality, maternal mortality in the hospital, right? You name it. Black mothers suffer it the worst. So that was the goal of the study. And in this study, they were also able to interview dads, right? So they interviewed about 2,500 moms 5 times over the course of 2 years, and they were able to interview about 1,400, 1,500 dads. So that's the data source. And in this study, they surveyed them on, you name it, right? Income, education, level of stress they're experiencing, blah, 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 blah. And for this particular study, we know that depression in dads has negative impacts on the family. Okay. It negatively impacts the mom. It negatively impacts the kids in like a million ways. Okay. But we don't know how involvement impacts the dads. That was the question, right? It's like, we know having depression negatively impacts the father's relationship with the family, but what impacts the father's mental health? So the goal of this study specifically was to see how does being involved impact a dad's mental health. And what we found was that dads who spend more time with their kids, dads who are able to provide more tangible support for their kids, so that's things like providing diapers, money, food, milk, and dads who felt more effective as parents, right? Dads who felt like, I'm actually pretty good at doing this parenting thing of changing diapers, getting bottles ready, all those things. They were less depressed a year later.
Okay. And I have a couple of questions. One thing that stood out to me when reading was no one had looked at dad's mental health before, or you hadn't found a lot of studies, any studies, I'll let you clarify, that explored fathers' mental health based on their involvement. Why do you think that is? Why do you think there was that gap?
So there is, just broadly speaking, there's a huge gulf of research on kids, moms, and dads. Okay, because that's the family unit. You know what I'm saying? At least in a heterosexual family, I want to acknowledge that families look different in a lot of ways, right? But in a heterosexual family, there's a mom, there's a dad, there's kid or kids. A lot of research has focused on the kids, okay? There's a lot of research on the moms and the relationship between the kids and the moms, how the kids affect the moms, how the moms affect the kids. But for a long, long time, like up until like the 70s or the 80s, dads were just not involved in research in the field of psychology or the field of like family research. You know what I'm saying? At most, they would ask the mom, hey, are you married to the dad, or does the dad live in the house? Yes or no? Okay. And that's it, right? They just weren't involved, and that is changing more and more now. But I think we have, cultural norms about what parenthood is, right? So back in the 60s, what was fatherhood, right? I wasn't there. I presume you weren't there either, right? You don't look like you was around in the 60s, right? No. But like watching TV, like watching the old show, fatherhood looks like mom is at home all day and takes care of the kids, and dad comes home and says, good job, boy, and then, does something, right? But it's usually mom who does the work, dad does a little bit, right? So I think that's why they weren't included, right? Because that was the image of what a dad does, right? They come in to do a little bit, but mom really handles it. So yeah, that's where the lack of research there comes in. And it's even worse for Black and Latino fathers and low income dads, right? That's really where there's just like very, very limited research.
Of course, of course. Which leads me to my second question. You had these participants already, but from what I've heard as a failed PhD student, not that I failed out of a program, I just didn't get into one. Clarification is important. There's always a challenge when it comes to finding Black, Latino, essentially non-white participants. So how did y'all get over that hurdle in doing this research, or was it already kind of packaged into the study?
Right. So that is you hit it on the head. That is a huge problem. You know what I'm saying? So there's a huge problem in research, just that men in general are less likely to finish a study or participate in a study than women. Yeah, it's crazy. It's just men. Men, right? But men are just less likely to do so, and then on top of that, racial ethnic minorities are less likely to do so. So why is that? Well, racism. That's part of it is that just men kind of suck, and men are just kind of suck in those ways. But then part of it is like racism and feeling disrespected by the institutions of research in the ivory tower, right? In academics. So for this study, we use something called community participatory research or community-based participatory research. All right. So I'll tell you what those are really quickly. So that means instead of being an academic coming into some community and saying, I want to do this study, I know all the answers, let me do what I want, right? Which is more likely to make people say, forget this, I don't want to be a part of that, right? This study, we had researchers from universities or hospitals go to community organizations and partner with them, right? And say, we think these problems are important, right? The issue of maternal child health is important, and it really impacts your community. So we want to find ways to study it and go with the community organizations that already exist, that already have a foothold, that already have a reputation, right? And partner with them to develop the questions that we want to ask and understand the things we want to do. And that really led to getting these high numbers of Blacks and Latinos in the study, and low income people in the study. Those types of methods.
Okay. Is that cheap?
It's neither cheap. It's not cheap. It's not easy, and it takes a lot of time. So it's hard, but it's fruitful.
Right.
This is how you get us to be in these studies, right? Because fine, you can get 500 white college students to participate in a research study. Sure, easy peasy, right? But what does that tell us about about the rest of us?
Exactly. That's why I bring it up, because there's your study, which does research on, one, a subject that hasn't been widely discussed as cultural norms have shifted, but two, also targets people that aren't reached in studies. And that's been a problem. Like I was just reading about how like the world was designed for like men who are 6 feet tall, or like The Office, the temperature is set for men wearing 3-piece suits. And, a lot of people are excluded when we make decisions or do research based on a certain group. So everybody, just be mindful of that when you're reading studies and thinking about surveys and, just evaluating critically whatever you're reading. So I have one last question about the study before we kind of look at the results and takeaways. You're a dad. Like how has the study, having done the study, doing the study, like how did that make you think about fatherhood?
That is the question. So, like you said, I am a dad. I have 2 sons. It's 2021, so they're 6 and 3. So, in the years when people watch this in, many years, I don't want them to think that they're still 6 and 3, but they're 6 and 3 right now, in 2021. And, I'd say that this research has really just, they say research is me search. You know what I'm saying? Oftentimes that you get to research yourself and your own experiences. And I feel like I've had a lot of insight into what it means to be a good parent, ways to protect myself as a parent, right? And ways to effectively take care of my children. Like I get to know that on the regular basis of seeing them every single day and picking them up from school and putting them down to bed and playing with them, but also from like just reading, right? And just doing data analysis. So, okay, wow, this is a good strategy, right? Like, or this actually isn't the best way to handle these problems, right? So I definitely think it's allowed me to become a more, how do you say, reflective parent, right? Reflective on my own practices. Like, okay, well, I've done this or I behave in this way, but is this really the best thing for my kids?
I feel like that's like a blessing and a curse almost, because you're so aware and you're second guessing based on what did I read, what did I do, or I think that's how I would do it. Like, what did I read, what did I do, and then at the same time you're like, oh, I did that right. They could write a whole paper about me. Yeah, I'm perfect. Right. Very cool, very cool. So thank you for sharing that. I know I didn't tell you I was going to ask that question, but you've done the paper, you've published it. Actually, one question about publishing, because again, it's pretty novel research. Any challenges in like thinking about where to publish it, or where to, like, what journals to submit to? I'm not like terribly familiar with the language anymore, but
I'd say broader, I do have concerns about where does my research really fit in, so like where does it really go? Who really cares, right? Because another issue that happens in research all the time, is that they will, like we talked about, they'll study things in white people, right? In white, middle income, high income people. And then if you study that in Black people, they'll say, oh, well, that's old already, right? We did that already. That's not new. That's not interesting, right? So I find that that's probably the bigger issue that I've come across, is that people are like, well, we saw that already. Like, don't you know all this research about, the Wellingtons that found, XYZ, right? And it's like, yeah, oh, well, that's them, that's a totally different context than what it means to be Black in America, right? So I think that's it. That's a major barrier I come across, from developing studies, finding funding for studies, to trying to find where to publish it. Absolutely.
I recently released an episode on the adjunctification of the professoriate, like colleges depending a ton on adjuncts to teach classes to staff, their faculty. And I feel like the two are kind of connected in that once, like you're saying, once the study has been done and you see yourself in the research, that's it. That the research is spoken. There's nothing else to be added to the conversation, and you're trying to add to the conversation, and people are hesitant. And then when you look at adjuncts, they're like, hey, like, you're not, treating us fairly. The pay is not equitable. But, the board of directors who are denying people tenure, or the tenured professors are like, this looks fine to me. How do we overcome that barrier? This is like a total aside, but I'd love to hear your thoughts.
The treatment of adjuncts and part-time faculty on college campuses and universities is absolutely unacceptable. Full stop. You know what I'm saying? Many of them don't have offices. They're teaching the same amount of classes as other people, but are getting paid like 10 times less. Now, I'm not exaggerating, like legitimately 10 times less, right?
Yeah.
Oftentimes they don't have access to health insurance, dental insurance, vision insurance. That sometimes their classes will just be cut, right? Because somebody else wants it. They'll just cut their classes, right? So the treatment of adjuncts is absolutely bad. And it's supported. The system is supported by the other faculty members who don't do anything about it, right? Like, who don't do anything about it, as well as the administration, who absolutely has the power to do something about it, but because, well, all the universities are doing it, right? So why are you putting the pressure on me, right? When this is where universities are going. It's all bad. It's all bad. If you asked me, I think the answer is collective action. You know what I'm saying? And, I'm happy I do work in a state that does have unions, right? So I work for California State University. It's a state university. We have a union. If you're a faculty, you're a member of the union, and they have certain things that they're promised to give you, right? Like, okay, if I promise you 2 classes this semester, you're going to get 2 classes this semester because that's written into your contract. So I think that kind of stuff is good, but on a broader level, it just takes everybody getting together and saying, particularly the people in power, right? The people like tenure track and tenure faculty to say, listen, I can't continue to work here unless you're going to pay these people and treat these people well, right? There's no
Yep.
other avenue besides that.
Yeah. And then in terms of the research, because it's your peers who are evaluating it, right? Like, how do you, what's the way to get them to see the value in the work if they're not seeing it like intrinsically or just like for what it is? Y'all can't see. I'm not releasing the video, but his thinking face is on point.
I find value for the people who find value in me. Do you know what I'm saying? So I guess on the individual level, I don't really care if you don't think my research is important. Like I really don't care, right? Because if you don't, you obviously weren't listening, right? That's my first thing. You obviously weren't listening. And two, I know it is, and people have told me it is. So I don't care. Yeah. From my peers, and I think there's always a place that will try to listen to, that does find it important, right? So while this particular outlet might act a certain way, somebody else is going to find it important because it's important.
Good. So let's talk about like the meat of the study. I know that was a hard pivot, but let's talk about the meat of the study.
Let's do it.
Fathers who are more involved, or what was it? Material support, effectiveness, and what was the third one? Help me.
Material support, effectiveness, and spend more time.
Yes. Okay, I was right the first time. Dang. Okay, so those are 3 measures. Less paternal depression.
For every single one.
That seems kind of obvious, right? But like you said, no one was looking at it before. What were the other important takeaways from the study, from your point of view, or generally?
I guess from my point of view, it's just that, paternal depression is a serious issue. Okay. So let me put it into numbers for you. Okay. So about 8 to 10% of men will experience paternal depression in the first year after their child is born. Okay. So that particularly is that time period, because that's like the really hardest time of having a kid, right? That first year. That's the time more likely there to experience it. A certain number of babies are born every day, like a lot. Okay. I think the number is like 100,000, 110,000 in the United States. Right. Okay. It's born every single day. With that means that about 10,000, 11,000 babies or men will be depressed every day, right? A new father is going to be depressed every day. You know what I'm saying? Yeah. And that's insane, right? That's a lot. Like that's a lot. Like just think, 1,000 new depressed dads a day, right? Like is that what you want to know, right? So that's it's a real issue. First and foremost, right. It's a real issue. 2, we know that there are things that are associated with it, because there are some issues that's like we don't know how to solve it, right? But no, actually, we kind of do know what is leading into these things for these men, So I think some of the big takeaways was, one, that the material support, right? So dads are less depressed if they're able to provide more, right? So that provider role, that protector role is a big role that fathers take on themselves. You know what I'm saying? So different members of the family believe they have different roles. Oftentimes, men feel their job, first and foremost, is to provide for their kids. Okay. And if they feel like they're unable to provide for their kids, that is not good. Okay. So we hope that there's opportunities and avenues to make sure that they're able to provide for their kids. Right. So that's number 1. We want to make sure they have that. Number 2, dads spend more time with their kids. That's good for them. Right. But there are a lot of barriers to that. Right. We live in a country that has very limited parental leave policies. Okay. And it really depends on where you live and what type of job you have. That determines whether or not you're going to get leave or not, you know? So for example, and that goes for mothers or fathers. I want to point out, I'm a father, so I'm talking about it from this perspective, but this goes to mothers and dads. So, you know, I live in California. I'm a state employee of California. Okay. So when both of my kids were born, I got 6 weeks off.
Yeah.
Okay. Which is like, you know, in comparison to most to other states and other jobs, that's pretty good, right? Because there's other people who they have a baby and their boss is nice enough to give them a week off, right? Their boss is just nice enough to say you'll get a week off, but we expect you back.
Yes.
So we want to make sure we have that time, right? Because one, it's a new baby. That's when you're learning those skills, right? You're not going to learn swaddling unless you swaddle the baby. Right. You're not going to be better at changing diapers unless you change more diapers. You're not going to be better at getting the milk ready unless you get the milk ready. Right. And if you're at work all that time, instead of doing that, that's impacting it. Two, at least in families where there's a mother or somebody who gave birth to the child, those 6 weeks, that's time to recover.
Yeah.
Right. So you need to make sure that you're able to be there to support them in their recovery from giving birth. Right. So we want to make sure we have paternal leave as well. So I think those are the two big takeaways.
Definitely. So U.S. parental leave policy has created like a trade-off of like material provider versus quality time, which then creates like how effective you can be as a parent moving forward. So that's terrible. But what about like support leading up to the birth of the child and then like in those first few weeks after? Because I think of those Mommy and Me prenatal classes, Mommy and Me group play dates. Does that exist for men? Is it like, are they getting pamphlets at the doctor's appointments too?
So this is another part of it, is that I want to make sure I use my language carefully. There are absolutely programs aimed at training dads, okay, across the country, right? Are they on the same level as mothers? No way. Are they well integrated into our healthcare system in any types of way? No way. Okay. So, that is research wise, but also to my experience, you know, my girlfriend at the time when she was pregnant, with our kids, I would often go to appointments, you know what I'm saying? Over and over and over and over. And every time I was there, it was just like these subtle hints that kind of, I was like, am I really supposed to be here? Right? Is this really a space for me to be here at all? You know? But then there was also a lot of dead time that was just like sitting around waiting, you know? In that time, wouldn't that be a nice time to be like, hey, why don't you come watch this 5-10 minute video about something? You know what I'm saying? Or, hey, like you said, here's a pamphlet on XYZ, on how to swaddle effectively, right? Here's a baby that you could practice on, or a baby doll that you could practice on. That's your baby, right? Just have a baby in the OB's office, just ready for everybody to practice on. So there are programs, but they're typically like run by like smaller community organizations, when I think we need a broader like paternal skills training program, right? That's a well integrated throughout all healthcare systems, because that absolutely does matter. And there's also research showing that fathers, or the men who supported their wives more while pregnant, also are the type of people to be more involved later on, right? So it's kind of a type of person too.
And then going back to your experiences at the appointments, did you ever feel like people were surprised you were there, or surprised like you kept coming back? And do you think that's a barrier? Do men feel maybe unwelcome going through this process?
Men absolutely feel unwelcome in these spaces. And this goes especially for Black men in these spaces. Okay. Like double, especially for Black men in these spaces. You know, I remember when, I don't know if it was my first child or my second child was born, there was just this nurse in the hospital who was just kind of like talking to me, just like in any sort of way, you know what I'm saying? And it reached a point where even my pregnant wife is on the bed, you know what I'm saying? Like, trying to whatever. And I had to look at her and be like, am I tripping? Like, am I crazy? And she was like, dog, you're not tripping at all. This lady has it like absolutely out for you. those kinds of things just maybe like, I don't want to be here around, somebody treating me like this. Absolutely. It is a huge issue that men don't feel safe or respected or accepted in these spaces, right? Because they should.
Yeah. And I'm just thinking, if you had left the room because that nurse made you feel uncomfortable, she would have been like, he was no good to begin with. Like, right, it's a lose-lose situation.
Exactly.
Okay. So I think that those are kind of my questions about like the barriers. Like, one, of course, parental leave, to just like making the space accessible, as you were talking about, but also the like education. There's so much support and so much branding around like making the transition to motherhood. There's, of course, lots of articles and profiles of celebrity mothers talking about postpartum depression or, challenges with kids. But I think what we hear about dads and joke, truth, whatever, is like, oh, sympathy weight. You've gained sympathy weight. And that's like the limit of what happens to dads during pregnancy or like when the kids first come home. So let me give you a magic wand. You can fix everything we just talked about. And you get 3 flicks of your wrists to fix everything. What do you do?
Number 1, I would ensure that there is a federal jobs guarantee. Okay, such that anybody who wants a job, there will be a job for you. Because I'm telling you once again, so many of these parenting problems are actually issues of money. Like they're actually issues of class and discrimination with regards to work and life experiences. Like so many problems come down to that. So number 1, making sure people have access to money and employment to be able to support their families effectively. So that's number 1. Number 2, I would, incentivize men going to prenatal appointments. Find ways to incentivize men going to prenatal appointments and find spaces to develop their parenting skills there, at those appointments. So, a lot of the time, like on the internet, we will talk about, like Target will sell wipes that are like dude wipes. These wipes that are specifically targeted toward men. But listen, if that's what a man needs to use the wipe, if you want him to use the wipe, you meet people where they are. Like at the end of the day, you meet people where they are. And if it has to be camo and camouflage for men to use it, put it in camouflage, right? Whatever it takes, So make space to integrate that into our healthcare system. Find ways to get them into appointments, make them feel respected in appointments and gain skills there. So 1, jobs, 2, appointments, 3, I would probably screen for mental health issues from new fathers. So take the time to ask them like, ooh, if it's at kids appointment, you could ask the parent if they're dealing with some type of stuff. If it's at a mom's OB appointment afterward, you can ask the dad if he's feeling some type of way. And for the dad himself at his own medical appointments, ask him if he's feeling some type of way. So just so that you can have some type of idea about whether those mental health issues are affecting the family.
Okay. I like it. So everybody, does a federal job come with paternity leave? Is that built in?
1,000%.
Of course. Okay. So 1,000%. We have the job. We have the appointments. If it takes guys wearing tactical diaper bags, let's do it. And then 3, just like building in mental check-ins throughout the process. I think that all makes so much sense. And when you say it and lay it out like that, it's like, why aren't we doing that already?
Doesn't it?
Always. That's the whole point of this podcast. Like, why? Like, these are.
It can't be right that we don't have this, right?
Yeah, that there's nothing there for men like who want to be engaged. I think we talked about the cultural norms. I think a lot of people are like, I want to be more involved than my dad or than my mom or than like whoever raised me. I want to be more involved than they were, and we don't make it easy. It's expensive to have a kid. It's expensive to take off for appointments. If you don't go to the appointment, then you're out of the loop. If you're out of the loop, you can't provide. So it's like a vicious, very vicious circle and cycle that people can find themselves in. So can I still rag on daddy daycare as a phrase? Should I be kinder, or is it silly?
No. You cannot babysit your own children. Okay. It is not considered babysitting your own children. You know what I'm saying? Like, that is your child. That is just basic child care. So I'm with you. There is no such thing as daddy daycare, right? And I think, I get it's kind of a joke, I don't want to, I don't like to take things out of the joking, whatever, but it speaks back to the cultural norms, though, of this idea that, like, a dad is taking care of his child as babysitting. No, that's your job, dog.
That's
you
yours.
Know what I'm saying? Like, if a parent taking care of their child is babysitting, I don't know what babysitting is anymore.
Right.
So no, absolutely. There's no such thing as daycaring your own other people's kids. Your kids with other people's kids is more like a play date even. So even then, I don't know, but I can accept it then. But if it's just your kids, no. Those are your kids. That's your responsibility to take care of them. So yes, joke on the daddy daycare people all day.
Yes. Boom. There you have it, folks. That was a Gold Hoe episode to prove me right.
You're right.
And we did it.
Ryan is right.
We did it. Just kidding. That is not always the goal, but it is a great bonus. Jide, thank you so much. I think we learned a ton about the process, about how we can support new dads, like individually, and then maybe start leaning on people like who are organizing or administering healthcare to be like, hey, drag this guy over here to practice on a fake baby how to do swaddling. There are no live babies to practice swaddling at doctor's offices. But
maybe. No, I'm joking.
Where can people find you on Twitter to read your bad food takes, okay food takes, and sports, and I think music? And then what do you have coming up that people can consume? Are you working on a book or anything?
So my Twitter is twitter.com/JideBam. So JIDEBAM. You can follow me. I think horrible food takes, okay food takes is kind of, not necessarily accurate. Once again, I'm a truth sayer. Hot takes. Absolutely hot takes. Okay. Maybe unpopular even.
Okay. I think
so
that's more accurate. Yeah.
That's more accurate. So that's where you can find me. I've had like a bunch of talks lately, actually. So actually coming up, I'm going to be like chilling, for the next little bit. Like, I'm actually going to try to just take the summer. It's been a long year teaching online. I'm going to take the summer to relax.
Good.
Yeah.
Then I'm glad we got this interview in before you go on relax mode. Thank you so much. Jide, that is it for real this time. Thank you so much, everybody. All the notes will be in the episode description, anything we reference, and that's it. We're going to go enjoy our weekend.
Let's do it. Thanks for having me.
Thank you so much. Thanks again to Jide for joining me on this episode of That Can't Be Right. I think we can all agree to eliminate daddy daycare from our vocabulary, but let's also focus on getting dads the support they need so that they can take care of their mental health, their kids, and not be the hapless half of an inevitably divorced TikTok couple. If you like this episode, please leave a review. If you want to hear more episodes, please subscribe. If you have ideas for a topic or a guest, send them my way. TCBRpod on Twitter and Instagram, or thatcan'tberight podcast@gmail.com. Happy Father's Day. Bye.